can you just say what ACEs are and talk about like the relationship to ACEs and trauma and how, you know, it helps you do the work that you do in working through all of that unresolved stuff that all of us have.
Yeah, I've never heard of that before.
Yeah. Oh, great. I'm so glad you brought that up then. So ACE stands for Adverse Childhood Experience. And there was a big study done with Kaiser Permanente with the Dr. Vincent Fillette. I believe it was in the 90s, the early 90s. It might have started in the 80s, basically where they started testing to look at people's level of developmental trauma, childhood trauma, and then their health outcomes that they experienced later in life. And they tracked, I think it was 17,000 people for a long period of time. And that was the beginning of this research. There's been a lot more since then. And there is a correlation between having certain adverse childhood experiences. It can range from anything to having a parent that's incarcerated, domestic abuse, sexual abuse, physical abuse, divorce, emotional neglect. These all fall under the ACE score questionnaire. And the higher your ACE score is, the more likely you are to have addiction, to have other maladaptive behaviors, but even more than that, to have autoimmune disease, to have cancer, to experience heart disease. And people with an ACE score of 6 or higher have statistically a truncated lifespan of 20 years, which is a big deal.
Oh my God.
It's huge. It was a great study too, but lots of good information from that. Whoa.
Yeah. Yeah.
Something that I thought of when you were talking about this idea that we learn behaviors to self-regulate, right? You both have brought up ideas around behaviors that are perceived by society as bad. I think it's also important to acknowledge behaviors that we get praised for.
Yeah.
So
Totally.
I'll give you a personal example of this. When I get anxious, I organize and clean my house. I get anxious a lot, so my house is very tidy. And people come over and will be like, how is your house so clean with children? Like
Praise,
yeah.
praise.
And then
Yeah.
I'm like, oh my God, it's like literally a coping mechanism. And what I do is I actually have awareness around it now. Before I just would hypervigilantly clean. And now I go, you're cleaning because you're stressed. Okay, like we're going to do that. But I get praised for that. And that's not necessarily something that should be praised because it's actually coming from nervous system dysregulation and probably a trauma I have unresolved, right? But I just think it's important. Like I used to get praised for hypervigilance around healthy eating.
Yeah.
And it was like, oh, that's a nervous system regulation pattern that's actually being praised by society, but it's actually coming from a really unresolved place in myself.